My name is Saul Tranquilino. I'm 34 and I have type 2 diabetes. And it's just that simple. I felt horrible. I mean, I just was sick all the time, even to the point where I couldn't eat, So I went to the doctor and I wasn't sleeping and, constantly going to the bathroom. So I said, I need to know what's wrong with me. They kind of knew already before they even did the blood test or anything like that. And that's what they did. And about a week later, they called me and told me I had type 2 diabetes. It wasn't tough to hear because I just wanted whatever was wrong with me to feel better because I felt so horrible. I mean, I can't even tell you exponentially how much better I feel just getting it under control, how bad I felt. The first thing I did was actually I got rid of all the pop in the house. That was the first thing. Like I took it actually over to my brother's house and I'm talking like cases of pop, and then I told my family, and we just started a plan from there. Diet, exercise, things of that nature. Actually started looking online because I'm a technology guy, looking for apps that would help me, watch what I'm doing, exercise, heart rate, things of that nature. And that was actually, I think, one of the first things we did. It's working out great. Like I count my carbs and my calories all the time, and it's amazing when you start putting in the things that you're eating on paper or anything, how much stuff that you eat in a day, and it makes you feel bad, For a little while, now I'm down to 1,100 calories and 150 carbs a day, and it's not a problem. Now at first I was hungry. But if I found if I went in a walk on the evenings or something like that, it tamped my appetite. Well, the first thing for me, and I was really big when I first started, was my first walk. I did it for 41 minutes. I only walked 1.5 miles. So it doesn't matter as long as you start somewhere, And I was dreading it. Like I'm sitting on the couch. I don't want to do this, but eventually, you just got to, just try to, One time, originally my goal was they say a habit is 20, you do it 21 times, it's a habit. So I thought if I went out and walked 21 times, in a month, I have a new habit. And that's pretty much how I started the program, just walking. Yeah. And that's all I still do now. I haven't tried to start jogging yet or anything like that. I just walk. And as long as my heart rate's up and I'm doing the right things, and it works. My nemesis actually is funny, it's pizza. I can't live with, I just see it and it's just like, I just look at it and I just love it. Everything else I've been able to let go of. For example, we have vendors come in and they brought pizza. I actually left the building because I had one piece and I was like, I gotta go. So I went and took my lunch at that time and went and got something healthier to eat. Because I don't do a lot of the shopping at home, so it was very important that, my significant other did a lot of label reading as well. And at first, we both did shopping together to know what we were getting into. And now that she does more of it, that's key. If she bought junk, I would eat the junk in the house. What was ever quick and easy. So yeah, when we exercise, it's as a family, me, her, and both my kids. We both all do it together. So it's more of a lifestyle change as opposed to, we don't even call it diet at home. We just call it, we're eating healthier. They ask us why we have to work out, why we have to exercise, and we talk about getting all the bad junk out of your body and replenishing yourself with waters and vegetables. It is very close because once you start keeping a food diary and they're looking at everything, because the numbers don't lie, they look at what you eat, how you're eating, when you're eating, what your sugar levels are. You can't look at a doctor and say, oh yeah, I'm doing everything just fine, and then give them the paperwork and it's completely opposite. So it's important that you like your dietitian and your doctor. It's probably the most important part for me, was that the ability to talk to them. Just stay positive. Just stay positive about it and make it more of a life experience as opposed to a hindrance in your life, because today I live normal. Nobody knows I have diabetes. When I'm walking around, nobody knows. Nobody's going to judge you for it. You just have it. And so if you just stay positive and include your family in it, I think most people will be just fine.